ME/CFS carry one or more leukotropic herpes viruses. Our colleague Daniel Peterson has shown that there is several herpes viruses, herpes 6, CMV, EBV, active, and that EBV infection correlated significantly with the presence of autoantibodies directed at thyroid peroxidase. In our group of patients, which is average of 37 years old and is female, we see 3 times more autoimmune thyroid disease than in the general population. That means we see 40% of our patients in general that have autoimmune thyroiditis versus at age 37 versus about 20% at age 60 in general population. So there's an increased incidence in thyroid antibodies in general. Australian studies recently confirmed other studies which we have been doing too. I rather took work from other people than ourselves, but I use those parameters in my daily practice. Increased plasma levels of IL-10 are very prominently present in, and it's actually an anti-inflammatory cytokine, interferon gamma and alpha TNF. Also FOX3 expression in regulatory cells increased. And now the work for Richie Shoemaker shows that not only in ME patients but also in mycotoxin patients there is an alteration in VIP receptor activity. So when I started to look at extremely ill patients in 2008, the Norwegian ME Association asked me to come and see extremely ill patients that were bedridden for years. And the youngest was, I think, at the time 21, I've seen much younger now, and have been bedridden, immobilized for several years, lying in the dark, light and noise sensitive extremely, and being fed by a gastric tube. So I knew that there were a lot of intestinal symptoms in this disease, but we hadn't focused on it yet. Everything was focused on the neurological part and also on the immune part of the disease, but there is an important gastrointestinal side to it. And a previous report by Kia showed that there are persistent enterovirus infections in the gastrointestinal tract of ME CFS patients, which he has his own way of treating. So we looked at these extremely disabled patients, and they had a Karnofsky score of 20 to 30. 2 had a Karnofsky score of about 10. 1 had been in a body bag twice, I think, or 3 times, and his mother rescued him, showing that he was still respirating. So these patients are extremely ill. We compared them with moderately ill patients with a Karnofsky score of 67. Contact controls, those who took care of those extremely ill patients, and non-contact controls. And we looked at the certain viruses that were supposed to be abnormal, but we didn't find any group in the blood. We didn't do any spinal fluid, but we didn't find any antibody differences in the 4 groups. For Bornavirus, there was in fact more positive controls than positive patients, and herpes 6 and EBV PCR, there were a few positive patients, but they didn't always correlate with the antibody titers, and that is probably because the immune system is not working properly. So this is a slide where we measured LPS in these 4 groups, and LPS is the lipopolysaccharides, and they come from gram-negative bacteria, and at the time we supposed that they were coming from a leaky gut, they were coming from gram-negative bacteria, and also when we look at the stool testing, I don't have time to show this today, you see in the stool there is an abundance of gram-positives. So we suggested that there is more gram-negatives going through the membrane of the gut. And so we thought that, in fact, you see that normal people have between 5 and 6 picogram per milliliter of of plasma of LPS, that the moderately ill had increased levels, and the extremely ill patients, there were 22 of them, had sometimes extreme levels up to 20 times the normal level of LPS. And so at the time, the most likely explanation was an altered intestinal flora of these patients. Another phenomenon we've been studying is the presence of prions. While I was studying these extremely ill patients, one of my colleagues made a new test to look at prion activity. He's an expert, he's a chemist, an expert in luminescence. And in the meantime, he has patented this technique to rapidly detect the presence of aberrant proteins, prions, and we know that they play an important role in some biological systems, and they could be also abnormal in ME/CFS, which we in the meantime have proven. Now, the abnormal three-dimensional structure of a protein can be something that is genetically present, and then you have specific genetic disease. It can be environmental, and heavy metals play a role, and that's why we're interested in ME/CFS autism in the presence of these prions, and also they can be acquired. These proteins are very important on the surface of the cells, and they play a role in detoxification. They play a role in opening and closing of ion channels. And so what we found in these patients, in these extremely ill patients, was there was an enormous quantitative increase in abnormal proteins, and we call them, in fact, aberrant proteins, but they are like a scattered type of prion disease. So the way we do this with luminescence, this is a normal signal of luminescence when it goes through these proteins, and when there's an abnormal protein, when there is a prion, it will show very clearly, and you can see the test doesn't take very long. Within 45 minutes you will know whether there is a presence of a lot of prions in these patients, and we can isolate them from blood, from urine, and from saliva. Now, something else. It has come to our attention that because in relationship with Th1 deficiency, there could be a lot of intracellular infections in these patients. And so we've been looking since only 2011 at a bacterium called Bartonella. Now, Bartonella is well known as Bartonella henselae and Bartonella quintana. Bartonella quintana is trench fever. It's almost non-existent anymore. And there's Bartonella henselae, which gives a disease in normal people, which is not even treated by antibiotics and is self-eradicated by the body. But in the meantime, our colleagues, veterinaries, have found 31 other Bartonellas, and there are 13 more on the list to be recognized as Bartonella. So there could be as many as 46 different types of Bartonella at this moment. So we made a special type of PCR which recognizes all the known species of Bartonella, and the test is complemented by giga sequencing, so we are absolutely 100% sure that the fragments of Bartonella we find are in fact Bartonella. So the first step is PCR, and the second step is giga sequencing, which is only done in certain university settings. Now, you can see I have patients from all over Europe. I only took the European patients, about 920, and it's about the same everywhere. And of course, those who come from outside Belgium, they are like sicker. And in Belgium, it's about 35%. Holland also, but the Denmark, Sweden, and UK patients, and Australian patients and Germany, Switzerland, and Luxembourg and so on, they are above 40%. So on the average, it's still 41%. And a colleague of mine in Washington, who's a rheumatologist, has looked also at patients with rheumatological symptoms and with pain and with fatigue, and he finds just the same number, 41%. So he has studied 296 patients. This was published last year in Emerging Infectious Diseases. And so we think this Bartonella is an important infection, and together with Bartonella always comes, or is possible to have Borrelia, because it comes from tick bites, but it can come directly from cats or other animals. And the PCR for these tests there are not 100% sensitive, because the peripheral measurement of Bartonella and Borrelia does not always show. These are tissue infections. And we isolated now also Bartonella from other tissues, like duodenal biopsies, stomach biopsies, from vaginal frottis, and also from spinal fluid. So we found those Bartonellas also in other tissues. Now the question is going to be, what about normal controls? What about healthy people? So we of course went to the blood bank, and these people are screened, and we find about 6% of people are positive for Bartonella in the Belgian population. And we are looking now, it's difficult, but whether these patients have a spouse that is sick. Because 70% of the spouses of these patients also carry the same infection. So this is something which is spreading like hell, and in Belgium, out of 11 million people, we expect to see that 500,000 to 600,000 people carry this infection. Now the Lyme is underestimated. If we use other techniques to detect whether people have been in contact with Lyme, if we use the LTT, the ELISpot LTT test, or other tests, these numbers are going to be higher. But what I want to say is that 40 to almost 60% of patients with CFS carry one or more zoonoses, and I think we must know that this maybe is the starting point of the disease in people who are predisposed with an abnormal immune system. Now we looked at the soluble CD14. Bartonella is a gram-negative bacteria, and soluble CD14 codes for LPS, and you can see that we matched 70 Bartonella positive with 127 Bartonella negative, and there is a very significant difference in soluble CD14. Soluble CD14 is clearly increased in the group that carries the Bartonella. And we did also the CD57, the famous CD57, and you can see that the number of CD57 positive is lower in these patients compared to a double number of controls that are Bartonella negative. So that stands with intercellular infection, and my interpretation is, why are these CD57 positive lymphocytes so low? My interpretation is that they are just attracted to the tissues, and that their number in the blood is lower because they are needed to fight the infection in tissues. And nobody has come up with a proof of that, but that's my personal interpretation of this. Now, patients, CFS patients with Bartonella, and where Bartonella was not shown, we looked at 50 different symptoms, and we looked at the differences, and they're clearly very CNS related, because anxiety, mood swings, nightmares, and difficulty to speak are symptoms that are correlate highly with the presence of Bartonella. Now, what does Bartonella do in the brain? It lowers serotonin. It lowers serotonin just like Lyme. Lyme patients also have low serotonin because there is a 2,3-deaminase that is active and that blocks the tryptophan metabolism, where tryptophan is put in different steps into serotonin. Also, alcohol intolerance is correlated with the presence of Bartonella, and then the last one was a little bit misinterpreted, I should not state that, and then also the presence of shingles and herpes simplex was also related to the presence of Bartonella, and these are preliminary findings that will be published soon.